Healthcare costs, the disease that's killing America. You ever wonder why the richest country in the world, the United States of America, is the only developed nation that doesn't have free healthcare? We've got billion-dollar hospitals, $20,000 emergency room visits, and insurance bills that look like mortgage payments. What if I told you that Americans could have free healthcare for everyone and not pay any more than they are paying now? Actually, they would be paying much less. Other countries manage to take care of their people for half the cost, or less. Let's talk about how that happened, and more importantly, what it would actually cost to fix it. Every year, the US spends about $4.9 trillion on healthcare. That's trillion with a capital T. To put it in perspective, that's more than the entire GDP of Germany. Ironically, Germany is one of the countries that provides universal healthcare to its people. Let that sink in for a moment. Now, here's the crazy part. Even with all that spending, millions of Americans are still uninsured, underinsured, or drowning in medical debt. Medical debt is the leading cause of personal bankruptcy in the United States. Millions of hardworking Americans are burdened by bills from hospital visits, surgeries, and emergency care. Not because they were irresponsible with money, but because they got sick. Across the country, Americans owe more than $220 billion in medical debt. This financial strain destroys credit scores, limits access to housing, and traps families in a cycle of poverty that can last for generations. You get sick, you pay. You stay sick, you pay more. So where's the money going? Let's break it down. Hospitals eat up about 31% of the total spending. That's roughly $1.5 trillion a year. Doctors and clinics take another 20%. Prescription drugs account for around 9% and rising fast. Administration, billing, insurance paperwork, red tape is roughly about 8%. That's hundreds of billions of dollars just to move money around. And here's the kicker. The US pays 2 to 3 times more for the same treatments and medications other countries get, for half the price or less. Okay, so let's imagine this. We keep our doctors, keep our hospitals, keep our medical tech, but we cut the prices to match the rest of the developed world, like Germany, France, or Canada. What happens? Our total national health spending drops from $4.9 trillion to about $2.2 trillion. Cut in half. We'd save around $2.7 trillion every single year. That's enough money to give every American free universal health care, wipe out medical debt, and still spend about the same as every other wealthy nation. And guess what? Those countries, their people live longer, they pay less, and nobody loses their house because they broke a leg. So where did the savings come from? Hospitals. $730 billion less if we stopped overcharging. Doctors and clinics. $350 billion. Prescription drugs. $220 billion. Just by paying what other countries pay. Administrative bloat. $280 billion. All that paperwork? Gone. Nursing and home health. $60 billion. Other services, $60 billion. In total, over $2.7 trillion could stay in people's pockets, or go toward actual care instead of bureaucracy. Now, I know what you're thinking. Free healthcare. Sounds too good to be true. But here's the twist. We're already paying for it. Between insurance premiums, co-pays, taxes, and out-of-pocket bills. The average American already spends more on healthcare than people in countries where it is totally free at the point of care. The difference, they pay through a simple, predictable system. We pay through chaos, paperwork, and panic attacks every time the mail says hospital statement enclosed. So let's call it like it is. America doesn't have the world's best healthcare system. It has the most expensive one. If we trimmed the fat, the overcharging, the red tape, the inflated drug prices, we could give everyone in this country full access to medical care and still spend less overall than we do right now. And honestly, that's not a fantasy. That's math. So the next time someone says we can't afford free healthcare, just remember, we already pay for it. We just don't get it. Maybe it's time we did. If this opened your eyes, hit that like button, not the hospital call button. Healthy people are productive people. Productive people build and strengthen the nation. A strong nation leads in innovations, discovery, and prosperity. Why would anyone not want that? Subscribe for more breakdowns that make sense of the nonsense.